Most people who work in the mental health business in Texas will tell you we have a crisis on our hands. So many people need help. Few are getting it. We saw it earlier this week when a mom pleaded for help for her son.
You don't know the heartache to see your son sitting in the police car, crying and yelling at you, "Mom, I didn't do anything," and watch him go away. Am I helping him, or did I just put him away?
And of course, military officials pointed to mental illness as the underlying cause of the tragedy at Fort Hood. We want to take you in depth now. KITV's Melanie Lofton explains why the people who need help are just not getting it.
Hard process.
We've heard the cries for help from a veteran.
These individuals need the help. They need it now.
And a mom.
To get him properly evaluated and get him mental help, whether he wants it or not.
So many need help and are not getting it until there's a crisis. Psychiatrist Dr. Maureen Adair says that's ineffective.
The crisis mode is not the solution that will help these people long term. It takes more than 2 days for psychiatric medicines to work to see if somebody's on the right medicine. And they can be discharged still feeling very depressed, very suicidal.
Dr. Jim Van Norman says funding is also a challenge.
In publicly funded organizations, of which Austin Travis County Integral Care is one of those, a lot of our funding comes from the state and from tax bases.
Texas spends around $39 per capita on mental health care, ranking the Lone Star State 49th in the country. Despite the challenges, Dr. Van Norman says he has seen a few things that make him hopeful. One is a provision in the Affordable Care Act allowing children to stay on their parents' insurance until 26.
A lot of the psychiatric illnesses have an onset between, say, 18 and 25. So if kids are insured, they have a better chance for accessing health care.
It's not a fix, but a step in the right direction. Melanie Lofton, KITV News.
Now, according to the National Alliance for Mental Illness, mental illnesses are more common than cancer, diabetes, heart disease, or even AIDS. But nearly 2/3 of all people with a diagnosable mental disorder do not seek treatment. Dr. Van Norman says if more people join the workforce, that could also increase access to care.